agreed health agenda, which is a process that doesn't seem to be out there in the way that we would all like, and could be pushed forward.
No, could you say that differently, and it goes in your direction? Again, what counts for a family child anywhere in the world is to have a shelter, not to be threatened, to have food, to have water, if possible, and a sewer system. And we know that when we have that, and when you fight from some basic infectious disease, that is vaccination, with that, you reach a level of life expectancy which is very, very high, and which is one in France 40 years ago. So really, really, you know, when you want to improve health and not medical care, and you should start there. There are few things which count, and these things should be available. So, how do you have access to clean water? How do you have access? How do you distribute vaccine, and so on and so forth? Okay. Then there's a second step, which is when that is reached, is how can you access to what the medical knowledge and the drugs that have been invented and are accessible. And that is a question, again, of generics, and how can you, people at the level where they buy the generic on an African market, how can they be sure that the generic they are buying is good? So what you are, the example you were taking is, you know, you can use codes or whatever in order to be sure that what you are buying is what you should be buying. But
it goes to standards. It goes to collaboration.
No, it's even, you know, even at the World Organization, we could have people controlling the quality of generics, you know. But again, and Petralo said it, even to distribute, to prescribe some good, efficient drug, you need to start to train nurses, doctors, and to start to have a system, medical care system, which is efficient. Okay. And also, we didn't speak about surgery, but obviously there is, you know, some surgery in some cases is the only way to cure people. Especially, as you know, in these countries, there are many road accidents and so on and so forth. So a lot of orthopedic surgery could be, in fact, very, very useful. And then when we go to very developed countries, you realize that at a certain level, medical care cannot do much because, you know, as you know, when you're obese, there is no way to go back, to be thin. You know, the likelihood of being thin when you are obese is like winning at the national lottery. It doesn't exist. It's 1 out of 10,000. So the question in our countries, and the problem of America is linked to that, or even the, you know, when you look in Morocco, the fact of changing life in Morocco leads to an epidemic of diabetes, which is linked to obesity and which is very high. You know, already 50% of health expenditure in Morocco is what we call in France ALD, affection longue durée, you know, chronic disease already. And in France it's 70% chronic disease. So, you know, when you want to have a world policy, you have to be sure that you tackle progressively the different level, and the limiting factor for the different country is not the same. So a limiting factor in Greece is honesty. Everybody cheat on everybody. In order to have a nurse at night, you have to pay. Okay, so it's not the limiting factor in Morocco. It's not the limiting factor in Ireland. It's not the limiting factor in Algeria. It's not the limiting factor in America or in France or in Germany.
Maybe Steve, I mean something where I think which is important is that I think we could agree that there is a need to put, the health together with education and together with food and water supply and basic needs on the agenda of typically of a G20. But at the same time, we need to recognize that it's not enough, and that you cannot just say this is that, and then you have the private players and the industry. You clearly need to have intermediate levels, which goes into governments, into local empowerment, and which involves medical system, which involves training and getting the nurses and the right physicians, which involves education and education of people. So I think this is also missing, and I think the industry as such. And I hear that here and there, the industry can be criticized, but the industry as such can really provide largely, available drugs at an affordable price. On the point on controlling the quality of generics is a good point. But this is what we can do. Another point which has been raised here is more, how do we evolve and do we take advantage of new science? And this all what these questions about genetics, but this is something which is progressing progressively, whether we like it or not. And it's more linked to the debate we had at the beginning of the meeting on innovation.
May I add an idea? When you debate, and I've been doing that for 40 years about health policy, we have reasonably good data for developed countries. And really, WHO is doing a very, very bad job about health statistics and health information. WHO, yeah. When you're trying to understand or to have some data about even, basic infection, basic disease, and so on and so forth. So there is really, we can plead for better information system about health statistics in general, and even health statistics in particular in many, many countries. And more than that, exchanges between countries about because, as you know, the World Bank said in 1978 that, the state should not intervene in health policy, so la Convention d'Almata, and that is a mistake. But I think the conferences and exchanges between these countries about how do you proceed? It's not obvious. How do you create a system, and what are the limiting factors, and where do you start? And I think developed countries exchange a little bit. Although, to sum up, each of us know something about the United States, but the Germans know France reasonably well, but the French don't know Germany very much. And there are very, very few exchanges about, health system, health policy, and so on and so forth in the world.
That's why I like Petra's idea about deciding to build a global health framework. Actually go after, there are a number of questions that are unresolved.
Yes, what I'm saying is consequences of an idea, how you could go one step further, how you can to build statistical data and so on and so forth. And WHO is a funny organization,
But you could decide to generate your idea from today. You could decide to generate this as a starting point from here.
I'd like to point out one other question, because I said, Mr. Ducasse-Vazoué, we need MDs. And how do we stop the stealing of MDs trained in Africa? Because 2 on 3 will never return to Africa. So we train them, it's a cost for the country. They come to France or in Europe or in Canada or whatever, and never return. So there is something unfair there. What can we do? No, I'm just pointing, this is global health governance. This is my opinion. We have to point out these kind of problems. Well, the president of Senegal recently said, I will train them in 5 years so that you will not be able to steal them from me.
The only thing you can do is offer them a decent life back home. And I wonder, is this actually the same for medical doctors as it's for other professions like engineers and whatever? Isn't it, or is this specific to health?
Hey, we have this problem. We have this problem in my country where.
So then the solution is to, you know, raise the economic standards back home.
Yes.
That's it.
Anyway, it's a big problem.
Yes, I absolutely agree. There are many, but I mean that's, you know, that's when I was thinking about what could, so you could make this a parameter,
That's
retention of health staff. And the only point is, from living in an industry that is performance management, as soon as you start measuring something, you put energy behind it. That's my only point. You know, if we have a framework, you can put in and out whatever you want, depending on which stakeholder thinks now this is most important. But once you start measuring it and looking at it, then to your point of local empowerment, I said this actually very early in my introductory remarks, I don't think we need the global governance system, because this won't work, but we need global standards and then enforce them locally. That was my proposal, adopting to the local situation. And then every country can think about how I do this, but there might be some solidarity in jointly agreeing this is an aim. Yeah. So that was the thought.
And Petra, building on what you're saying, can you then link it to growth, to productivity? Because I think that modeling would be really interesting and really important to the G20. If this chain, if this framework works, then you get better growth in the country, and etc. That's what's happening in Africa today.
Yeah.
So a global health framework that you're going to lead, Petra, because it's your idea, that has a number of parameters that are identified, like retention of doctors or whatever it is about fake drugs versus, you know, legitimate drugs, etc. You can build this framework over time. You can actually start and build this together. The WPC doesn't have to do it for you, but it can be done by those who have a commitment to making it work, starting here. You have a beginning.
Well, maybe we should, it's time to go.
Okay, so thank you all of you for this interesting debate. So it was, I think that we were wondering at the beginning who would come, and obviously it has been a very living live. Sorry?
Jerome will report.
I think that we are going to share that. Okay.